So welcome everybody. I'm excited to share how important the gut is with the mouth and how it's all connected. And so I want to introduce you to Cass Nelson-Dooley, who wrote the book, Heal Your Oral Microbiome. How much better is it than that? So Cass, I'm honored to have you speak with us today, and we are recording this so people can hear it another time as well. And we'll take it away, and we have an hour to an hour and a half, so there are lots of questions we can continue. So whatever your time frame is fine. So, and good morning, Candace. I'm going to have you mute yourself, please. And yay. All right, Cass, take it away.
Okay, great. Well, I am also so honored and happy to be here. I'm excited about your organization. I found out at the Institute for Functional Medicine meeting this past week, I actually had the chance to meet Jack Call and Kim Smith in person, which was a surprise. They didn't know I was going to be at the meeting, and I didn't know they were going to be at the meeting. And I found out that your organization just has a very long history. I believe that I knew about it many years ago when I was working at Metametrics Clinical Laboratory, and we did have interactions with biological dentists, and the mercury question was a big one. We did mercury testing. So I feel that I have a history with IAOMT, and I really am impressed by the many years you guys have been doing this, and your breadth of knowledge, and the fact that you're not afraid to say something that other people might disagree with. So like I said, just before we jump in, I want to tell you guys about this meeting I just went to, where IAOMT is also had a booth and a representation there. This was the Institute for Functional Medicine, their 2023 annual conference, first time since COVID that they've had their annual in-person conference. And what was very special about this meeting is that they were talking about the oral systemic connection and the oral microbiome at this meeting. So this is the first time that we've seen this topic come on center stage in the functional medicine world. And I mean, they've been interested in it for many years, maybe going back 10 or 15 years, kind of dabbling in it, talking about it, teaching, oral exams to functional medicine practitioners. But this was a big step to have it. They had a keynote by Dr. Doug Thompson, and they had a breakout session co-taught by Doug Thompson and Dr. Doug Thompson, Dr. Ellie Campbell, which I'm sure many of you may know them. So, and they did a spectacular job. It was great. It was to me, it stole the show. And their breakout session was excellent. It was very practical for clinicians, for dentists. They talked about the oral systemic connection. They had real life take home tips for, bringing it to clinical practice, and, blood markers to monitor systemic disease that may be coming from the mouth. So there was a lot of excitement. It was very well attended. I think clinicians are really getting it, how important the mouth is to the gut. And I think it's a very exciting time. Also, Oral DNA Labs had a booth there, their first time ever to the conference. And it was just coincidence that they happened to make it their first year to be there, and then later find out that oral microbiome was on the itinerary. And so they were very well received and got a huge interest from clinicians. So I feel that the importance of the oral microbiome and oral systemic health, while many of us have known about it for a long time, it's like the wave is breaking. I feel that there's a building interest. People are connecting the dots, and we're starting to really see some changes. And I think we may, I'm hoping for transformation in how we address oral and systemic health. So I just wanted to share that with you because I just am very excited after that meeting. So as you guys may know, I'm the author of Heal Your Oral Microbiome. And I think what I bring to this topic that is unique is I look at the oral microbiome through the lens of functional medicine and gut health, because that's really where I come from. I come from natural medicine, botanical medicine, and lab testing and the gut microbiome and functional medicine. So that's really my background. And so when I came to study and write about the oral microbiome, I can really see it through that lens. And not everyone can do that. So I think that's something I bring to the table. Okay, so let's dive in here. We have the dentist looking in the mouth, and this is a joke, right? Your heart and your lungs look good too. But we could say, well, this isn't actually it's such a joke. I mean, this is kind of real. You can look in the mouth and see what's happening with the heart and what's happening with the lungs and what's happening with the gut and what's happening with the joints and how the brain's doing. So that importance of the mouth to every other part of the body is something that I know you guys know about already, but it's something that we want everyone else to learn about too and to know better. And actually, along those lines, I'm normally teaching this presentation to functional medicine practitioners. So they're focused on health from the neck down. And, and I'm helping them understand why is the mouth so important and why they need to incorporate the mouth in their comprehensive healthcare plan and assessment. But you guys already know the mouth is really important. So it's a little reverse with you guys. The presentation today, we're going to not be focusing as much on the mouth and how important it is to systemic health, but how systemic health is important to your care of the mouth. So we're flipping it around today, and we'll see how this goes. And I do have time for questions. I feel questions are so important. And so I'll pause when we are to a questions point. We'll see what we have there. And if we can stop at that time and do questions. And if not, I'll go into some more treatment ideas. So that was kind of my plan for our time together today. So the mouth houses the second most diverse microbial community in the body. So when we're talking about the oral microbiome, we are talking about an extremely biodiverse ecosystem, second only to the gut. So everybody's excited about gut microbiome and all that it does for us. Well, the mouth is only second in line. It's very important. And in my book, I actually, one of the criticisms, when you get criticisms on Amazon, one of the criticisms was that she says the same thing over and over again about location. And I really do. Hey, the mouth is right there at the beginning of the gut. So how can we ignore this location? It's fundamental. We can't separate the mouth from the gut, from the systemic circulation. This is part of the whole. And its location at the beginning is critical, right? This is where the immune system first sees outside foreign foods, chemicals, etc. This is, it's an interface between the outside world and the inside world, and it starts in the mouth. And I love this quote that Debbie Osment gave me. She says, all disease begins in the gut, but the gut begins with the mouth. So I like that little quote for crystallizing that idea. So we're swallowing billions of bacteria each day into the gastrointestinal tract. So, just by nature of gravity and the direction of saliva flow, we are putting bacteria from the mouth into the gut. So are we putting good bacteria into the gut, or are we putting the pathogenic bacteria into the gut? The last number I heard is that we have about 770 species characterized in the oral microbiome. And these are bugs that can be both aerobic and anaerobic, as you may know. Some like oxygen, some like lack of oxygen. They live in complex biofilm communities, aka plaque, as you guys know very well. And I always like to remind us, you know, we are just scraping the tip of the iceberg. You know, we only have learned about these microorganisms since DNA sequencing technologies and quantitative and PCR came around in the last 20-25 years. So prior to that technology, we could only see about 50% of what was there. You know, culture is very limited. It's especially when you're dealing with anaerobic bacteria, you just can't culture them easily. So these DNA analysis technologies have been critical for us to understand the microbiome, the gut microbiome, the oral microbiome, all the bacteria. And there's more to learn. You know, there are so many that are still unknown, uncharacterized, that we don't understand yet. And I like this word cloud because, you know, even in our talks at IFM this week, there is still actually Jack and I spoke about this. He very eloquently pointed out, we have this pathogen-centric model. We are really focused on that one bad bug that needs to be killed, you know, or maybe there's 3 bad bugs that need to be killed. And that isn't wrong. You know, there's definitely time and place for killing those bad ones. But, you know, my point in writing the book, Heal Your Oral Microbiome, is we're trying to shine light on the good ones, the good bacteria that do many good things for us. And, you know, most of our oral microbiome testing at this point does not tell us anything about them. And I can't say that's bad, because, you know, sometimes you see a test and you're like, okay, look, there's good bacteria. Okay, good. It's kind of simple, but often too, I know with the gut, we will find that people have low levels of good bacteria, and that's a huge problem. Or they can have too many good bacteria, and that's kind of a puzzle. Why? You know, what's going on with that? How do we help balance it? So this word cloud helps us see, you know, the biggest words are the highest abundance of microbes. So streptococcus, of course, is greater than 20%, makes up to more than 20% of our microbiome. But these smaller words are other bacteria, you know, the bacteria that are hanging out behind the scenes, that are normal, that are not hurting us, that, you know, do good things for us too. So yes, we're worried about pathogens, but let's also embrace all of the many billions of bacteria that live in our mouth that are not causing harm. So, and let's just talk about some of the benefits. Again, I kind of want to turn it on its head. I don't want to just talk about pathogens, because we have all been trained about how bad pathogens are. There's no doubt, you know, a bad bacteria in a person who's vulnerable is a bad situation and needs intervention, and sometimes very aggressive intervention. But let's talk about the bugs that hang out in the back on the back burner that no one ever talks about, and what they do for our you know, our patients who have a healthy mouth, for example. So these good bacteria do something called colonization resistance. It's exactly what it sounds like. They provide a living biological barrier against infection. So those good bacteria fight infection and fight pathogens and take up space so that pathogens cannot take hold. They also help us make nitric oxide, that critical blood pressure lowering chemical that we need. They make up to 25% of our daily needs of nitric oxide, or they help us make those. We cannot make it without their help. They regulate the immune system. Good bacteria are good at telling the immune system to chill out. You know, our immune systems are kind of programmed for inflammation and attack, and good bacteria can help calm them down, promote T regulatory cells, tell the immune system, you know, even they can sometimes hide from the immune system so that it doesn't attack them. Our good bacteria provide anti-inflammatory activity, kind of along those same lines, and they promote health of the oral barrier. So the strength of those tissues, the gum tissue, the cheek, the tongue, you know, good bacteria help promote these healthy tissues. And one way is through the production of secretory IgA and immunoglobulin in the mouth that then helps fight infection. So those are just some of the ways that our good bacteria help us. And let's talk about similarities between the gut and the mouth. So there are so many similarities, and I really use this in functional medicine to help practitioners understand, listen, it's not as hard as it may seem, because there are, and you know, we can think about this for you guys too, kind of in the reverse, which is there are so many similarities between the mouth and the gut that you know, it's not a foreign organ. I mean, the microbes are organized in biofilms. Imbalances in bacteria, both in the gut and the mouth, can lead to immune system reactions. The immune system itself is really similar in both the mouth and the gut. How it's you know, how it's set up, how it interacts with stuff coming through the mouth and the gut. Both the mouth and the gut have an epithelial lining, or you know, it can be the gut lining or the mouth lining or the mucosal barrier, however you want to call it, that is permeable. It's not, you know, ironclad. Things can get through it, and if it is damaged, even more things can get through it, and it can be a real risk factor for other diseases and symptoms. And then, of course, the diet, it dramatically influences the microbial populations in the gut and the mouth. Sugar is, you know, terrible for these bugs. Refined carbohydrates are terrible for the microbial populations. And then if a mother has a C-section birth, then there is less microbial diversity, both in the mouth and the gut. So, you know, it's the same thing, gut and the mouth. They're just, in my book, I say they're just two different stops on the same bus line. Okay, so gastrointestinal illnesses, there's many gastrointestinal illnesses that are linked back to the oral microbiome. So celiac disease, you know, in celiac disease, we have seen manifestations in the mouth, colorectal cancer, esophageal cancer, pancreatic cancer, stomach cancer. These also show these gastrointestinal illnesses have an imprint in the oral microbiome. They have now, you know, cause and effects, I don't presume to say, but they're related, we know. And H. pylori in the stomach, of course, can cause gastritis and ulcers and stomach cancer, and it is an oral microbe, as you guys may already know. I talk about that extensively in other places, but H. pylori in the mouth is related to H. pylori in the gut. Also, inflammatory bowel disease, irritable bowel syndrome, and even SIBO, small intestinal bacterial overgrowth. So these, you know, when you have a patient who's got oral symptoms and gut symptoms, then, you know, that should flag you that these two conditions may be connected. They may be interrelated, and you may need to, they may both need to be addressed to achieve resolution of both illnesses. You know, you have to kind of address them in conjunction. So periodontal disease and cavities are the most common oral diseases of humankind. I don't need to remind you guys about that one. And I probably don't need to tell you guys about this, but you know, as a functional medicine person and someone who really studied the gut microbiome in the past, it was a surprise to me that every single dental disease was really just an oral dysbiosis. It was really just a bacterial imbalance. So, you know, cavities are bacterial imbalance of on the tooth surface. Periodontal disease is an imbalance under the gums that triggers the immune system and causes damage to bone and teeth. Root canal infections are a bacterial imbalance in the pulp of the tooth. And then root cavities, again, are a bacterial imbalance. So, I mean, you guys are treating oral dysbiosis when you're treating any of these conditions. You could argue that at least some cases of bad breath are also oral dysbiosis. So, you know, my joke is that dentists and dental hygienists, you know, you guys are working with treating the oral microbiome every day, all day. I mean, you guys are microbiologists. So it's just, you know, maybe refining how we approach it. So really, it's thought that, I mean, it's believed that while there's overlap between the gut and mouth bacteria, really they're supposed to be kind of different. You know, the gut is a really kind of a different environment than the mouth. And the stomach is really supposed to be this harsh, acidic environment that kills oral bacteria. They shouldn't just be able to come, you know, go right into the gut and set up shop. Now, in functional medicine, of course, we would say, well, you know, who has a healthy stomach with healthy levels of stomach acid? Who is digesting well, really? You know, who has a strong gut barrier? Because it's really you know, that the host needs to have those characteristics in order to keep the oral microbiome where it belongs and the gut microbiome where it belongs. So we often see people have digestive disorders, and that would mean they are vulnerable for oral pathogens, oral dysbiosis to set up in the gut as well. And you know, this isn't well understood. You know, there are oral bacteria that live in the guts of healthy people, like strep and Veillonella. So, you know, this isn't all hammered out yet. We're learning all the time. This was a really interesting paper that, you know, just laid it all out. It laid out the how oral bacteria are getting into the gut, but also getting into systemic circulation. So up on top with the pink, where we see the pink shading, this is where, you know, oral bacteria get into the bloodstream. Right? General dental activities, dental procedures, you know, even chewing, brushing, and then of course, oral diseases would make this worse, right? Where the gums are leaky, there's more inflammation, there's more pathogenic bacteria. So this just gets you know, absorbed right into the bloodstream. And you can see all of the oral bacteria listed here that have been detected in circulation. So, I mean, it's not a closed system, right? Now, you can also, of course, you know, oral bacteria will move through the gut as well. So the enteral route, as they mentioned here, and it's highlighted in blue, we have, you know, when people are taking proton pump inhibitors, which I don't even know what percentage of the population it is, it's extremely widespread. People with gastritis or gastric surgery. And you can also have hypochlorhydria just due to poor digestion or aging, where you don't have enough stomach acid and you cannot break down and kill microbes that are coming down the GI tract. And then here they say, as we talked about earlier, disruption of gut colonization resistance. So if someone has antibiotics, if they're eating a terrible diet, there can be environmental factors, there can be other diseases, you know, in you know, virus even that could change the environment of the gut and make the gut more susceptible to being infected with microbes from the mouth. And oral bacteria, many oral bacteria have been detected in the gut. So I want to, all I could, I don't know, of course, the ins and outs of your profession and how you guys work with your patients. I just know how my dental hygienist is with me. But, she's amazing. She's full of information and, very helpful in kind of day-to-day practices. And I know that she would not refer me out for any other care, but you guys are, and she's not, a holistic or integrative or biological dental hygienist, but you guys have more of the whole system in your minds. And so whether you can do this on your own to refer out or work with the dentist in your office to refer out, I hope that you guys can build your network to, with other practitioners who do functional medicine or naturopathic medicine, integrative medicine that can work with you. But I would say that it's a good time to refer out to a collaborator when your patient has an oral dysbiosis that is not responding to treatment like you believe it should respond. When there is gastrointestinal illness too, that needs attention, and it might be holding up your improvement of their oral health. When there's systemic disease, right? And I know you guys are, just a reminder to everyone to mute themselves. We're getting a little bit of background noise here. When there is systemic disease, so, I know, again, probably, huge percentages of your population have diabetes, cardiovascular disease. But of course, these are, the mouth, if they have periodontal disease and diabetes, they need care for both. And if they have periodontal disease and cardiovascular disease, that's dangerous. So these are, these patients need a collaborative treatment, both dental and primary care. So also, if the patient cannot institute necessary lifestyle changes, this is a big deal, right? Getting your blood sugar balanced when you have diabetes and making all of the changes is incredibly difficult. So just to kind of remind you guys who's out there, again, not really knowing how you guys network and collaborate. Of course, there's naturopathic doctors. I always feel, when we say integrative and functional medicine, many naturopathic tenets are included in that title of integrative and functional medicine. But, naturopathic doctors, I think, have had it right for many years, many decades ahead of other doctors, and their teachings have kind of been embraced and used in functional medicine. So in the conventional medicine model, we've got MDs, DOs, physician's assistants, nurse practitioners. Many of these, let me not say many. There is a percentage that are trained in functional medicine, certified in functional medicine, and I think that's the type of person you need. You can also, as you guys may know, Oral DNA Labs has a directory. And there's diamonds next to the practitioners that do lots of oral DNA testing. And sometimes you can find, medical doctors or practitioners that are doing oral DNA testing. And that would be a nice colleague to have. Dietitians and nutritionists. So I'm not sure if you guys know this, but functional medicine has made a real effort in training dietitians and nutritionists. And since the diet can be so critical for systemic disease and also oral disease, and some of these nutritionists and dietitians are extremely savvy and really excellent with it. They're basically doing functional medicine with diet and lifestyle and supplements without the MD behind their name. and they're more affordable, and they meet the patient where they're at, and they really help them implement the changes. Functional medicine health coaches are also excellent at that, and some of these clinicians, these functional medicine practices will have health coaches in their practice. I mean, that's a really incredible practice to align with or to, refer out to. So I just wanted you guys to know who's out there who might be able to help your patients who need help, outside of their dental care. And so let's talk about a case. I love case studies. I think this is just the way to learn. And this was a really interesting case. It took me a little while to find it. And I want to warn you that it's a very complicated case. It's one of the most complicated cases I've ever put together, but it's also a wonderful success story, and I think it's worth sharing. So just given our time limits, I won't go into all the nitty-gritty of this case, so I'll kind of glaze over some of the areas. You're welcome to ask me questions, but I didn't want to spend too much time. I mean, we could spend an hour on this case. So, okay, so this was Brooke. She went into her functional dentist and said, my gums are bleeding and my teeth are sensitive. I want a more holistic approach to dental care. I feel like my mouth is contributing to my health issues. So Brooke was a 37-year-old African-American woman. She hadn't been to the dentist in quite a while. She had some anxiety about that. She did have bleeding gums and sensitive teeth. She had been a vegan for 4 years. She had 2 children, and she had iron deficiency anemia, pretty severe. Her chief complaint was eczema. For about 25 to 30 years. She had had it since she was a little girl. And I'll talk more about it on the next slide. She also suffered with constipation and extreme fatigue. And I do write. Oh, pardon me. I hear a little bit of feedback, but I do have a case, a blog that I wrote about this. You guys, I'll talk about it at the end, but if you go to my website, I have a blog and I wrote this case up in detail. So Brooke had eczema since childhood on the backs of her legs, arms, elbows, neck, and back. She was treated with increasing amounts of topical and injectable steroids long term. So since being, a 5 or 6 year old, she was getting steroids, topical and injectable. At some point, her physician retired, and the new physician, was aware of the risks of chronic steroid use and started to limit her prescriptions, at which time she had massive breakouts of inflamed, extremely itchy, swollen eczema, breakouts all over her body, which she learned were characteristic of topical steroid withdrawal. And the whole thing made her think, you know what, I don't like this. I've been taking steroids my whole life, and now I'm having symptoms because I'm going off of them, and I want to figure this out. I want to get healthy. I don't want to be taking medications for my skin. And she kind of went to a functional medicine practitioner, and she also went to a functional dentist at the same time, because she believed that they were connected. Prior test results, she had high CRP. As you guys may know, that is a marker of systemic inflammation. She had a high SED rate, so her immune system was upset, kind of pointing toward, potential autoimmunity. She had a lot of IgE reactions to inhalant allergens, which we might expect in someone who's kind of an allergic presentation with all that eczema. She was rock bottom for all of her iron markers, vitamin D. Her hormones were low, cortisol was low, so she was very depleted. Her existing oral care at the time was electric toothbrush, twice daily, fluoride-free toothpaste. She was taking some vitamins. She was taking hydroxyzine for anxiety. And as I mentioned, she was also under the care of a functional medicine doctor. So we're going to talk about both. This case, I got it actually from a functional dentist, but she was so kind to kind of let me interview the patient And then it grew into a functional dentistry and functional medicine case together. So you'll see how this unfolds. Brooke had several cavities. She had old amalgam fillings. She had a failed root canal. She had partially impacted teeth, 1 to 4 millimeter general probe depths, but 15 areas did have 4 millimeter pockets with moderate bleeding and light plaque and tartar. So she was given the diagnosis of moderate gingivitis. Here is her periopath test. So we do see that she had some high-risk pathogens present, and then some moderate risk pathogens as well. Now, her functional medicine practitioner kind of threw the book at her. I mean, he did a lot of, his name is Ryan Monahan. He did a lot of treatment with her, and he's actually an online practitioner. So he's actually available, you know, maybe if you have tough patients. He specializes in autoimmune disease, although that's not what she had. He found that she had a highly positive SIBO breath test. We're going to look at her stool test. She had bacterial and fungal overgrowth. They detected mycotoxins or mold exposure. She showed multiple nutritional deficiencies. Blood testing also showed that she was reacting to gluten. As we talked about earlier, she had low hormones like cortisol and progesterone. She had high oxalates, which they worked on. Her iron was still rock bottom. I mean, look at that, 3. So she was, I mean, kind of wonder how she was getting around with that much iron and oxygen. Now at this time, her CRP was normal. And then she also had high blood eosinophils, which we often look at as a marker of either allergies or parasites. So, and she had allergies. I mean, she was reacting to inhalants and probably things that were touching her skin as well. So this is her stool test. I know you guys aren't used to looking at these, but this is a PCR, you know, quantitative PCR stool test, much like the oral DNA labs test, which looks at PCR of those microbes in the mouth. And these were her good normal bacteria, so good bacteria, the commensals, and they were normal and some were overgrown. We don't have to read into that too much. But when we get to the opportunistic bacteria, we see she had lots of highs. So lots of bacterial overgrowth, very high levels. This candida was found in her gut also. This is it's a moderate amount. That's why it's not flagged. It was moderate. It was not high. It's moderate. She also had problems with digestion and this secretory IgA. I mentioned it earlier, immunoglobulin A. It's found in the gut. It's found in the mouth. It's a defender, immune protein that defends and protects us from infection. And that was low in her gut. So here is what the practitioners did about it. So the functional dentist, Sarah Poteet in Texas, she did a guided biofilm therapy with ultrasonic ozone water, ozone gases subgingivally. She had 4 cleanings, and she did give her systemic antibiotics for 8 days for that periopath result. She also advised her to, you know, use a Sonicare at home. She was doing dental Sidon, liposomal oral rinse, close-cis oral rinse. So really, you know, working on the bacterial overgrowth at home. She gave her pro-resolving mediators. These are from fish oil. If you guys haven't heard of them, they're a really interesting anti-inflammatory supplement, over-the-counter supplement. Vitamin D, she gave her a dental probiotic. And she also gave her oral probiotics for gut systemic health. Okay, and then you know, they extracted the failed root canal and impacted lower wisdom teeth. So Brooke had a lot of work done. Her active tooth decay was treated, and her amalgams were removed with the SMART technique that you guys know so much about. Now, so that was the dental piece. Now we're looking at the functional medicine piece. So Brooke had a very heavy duty protocol that many patients might not be able to do. So starting with the gut, she was given herbs and digestive support, bitter herbs, and that's HCl, hydrochloric acid. You read it right. Functional medicine providers, as long as the patient doesn't have any contraindications, we often use hydrochloric acid to help acidify their stomach and improve their digestion. The clinician also gave her Saccharomyces boulardii. That's a friendly yeast, basically a probiotic, spore-forming probiotic. That's another friendly bacteria. Immunoglobulins to kind of help. We talked about immunoglobulin A a couple times now. So these are supplements. All of this is over-the-counter supplements, high quality brands, companies, physician level companies, but these are all over the counter basically. Immunoglobulins help bind and neutralize and clear toxins, pathogens, and allergens. And her secretory IgA was low on her stool test, so this made sense to kind of help her out. And she was given herbal antimicrobials, herbal antifungals. So, we're talking about basically antibiotic herbs, antifungal herbs. She was given a tea called Matula tea, which helps get rid of the microbe Helicobacter pylori, and also motility herbs, things to help her gut start moving since she was constipated. Now, she was highly inflamed, and the clinician was working on that too. So he really modified her diet. She tried some different diets. She went on a temporary low FODMAP diet. You guys may have heard of that used in SIBO. This is only something to be used temporarily. I'm not a big fan of using this for any long-term period of time because I don't think it's healthy diet. But it can help with symptoms when patients are in having a lot of suffering. She did paleo diet. So even though she was vegan, she ended up bringing meat back in. She did paleo diet with no grains and no sugar. They did a very rigorous gluten removal, including trace levels, and gave her enzymes to kind of help her degrade wheat when she came into contact with it by accident. And then she took some supplements to lower inflammation, a Th2 modulator, fish oil, and the enzyme diamine oxidase, which helps break down histamine. So I don't expect you guys to remember any of this or even practice this unless you're interested, but just so you know, these things are out there that integrative and functional medicine practitioners are doing. Now, clearly she needed nutritional help. She was depleted. The iron and the vitamin D were the most obvious, but you can assume in someone like that they're missing nutrients across the board. So there was a big focus on iron supplementation. She took prescription iron and then transitioned to some more natural whole food sources. She was taking magnesium, riboflavin, B vitamins, activated B6, minerals D and K. And they also felt that there was a mold exposure. So her house was tested for mold. She ended up moving homes, I don't think because of the mold, but just for other reasons. And so she was treated with some supplements that help to bind the toxins that mold creates and just try to help clean the body clean out the body of that exposure to mold. And she had trouble with her hormones. Like I said, this is the most complex case I've ever written up. I mean, she was in a terrible situation. And I mean, clinically, she really was, at the end of the line for her. So it wasn't surprising to see that biochemically, hormonally, nutritionally, inflammatory wise, she was a mess. Her hormones were low, so there were some supplements that were given for adrenal support, hormone balance support with the Vitex, the chaste tree berry that should be chaste, liposomal glutathione to support detoxification, and even topical progesterone. So how did Brooke do with this protocol? At 7 months, we got a retest. So we got to see her oral health, and you can see that her bacterial load was actually 44% lower. She did have some of those high-risk pathogens disappeared, right? And the moderate risk pathogens and the low risk pathogens decreased some. Her dental exam showed remarkable improvement in the inflammation and appearance of the tissue and plaque. Before treatment, she'd had 15 areas with 4 mm pockets and bleeding. And after treatment, she only had 1 4 mm pocket. And these pocket depths and bleeding were greatly reduced. So she was looking a lot better. And so this was basically after 6 to 7 months of treatment. I mean, it's not that much time. She had, but it was both, the treatments at the level of the mouth were really intense, and the treatments for the gut were really intense, and the systemic health were really intense. So she was doing a lot of things to get better. Here is her follow-up. These are her good bacteria. And remember, I have the before image over here with a couple of highs. I don't know if you guys can see my pointer, probably can't, but the follow-up or the after shows low levels. So this isn't shocking. She's been on antimicrobials. She's been on antibiotics. The gut microbiome has taken a hit. Surely the oral microbiome, the good bugs that we don't see on testing, those probably took a hit too. But in her case, it was necessary. We did see a little bit of H. pylori, Helicobacter pylori show up. This is her opportunistic bacteria. So they were lower. Her candida had disappeared. So she no longer had candida in the gut. We did see one elevation left over. But here's a before and after where you can really see how bad the bacterial overgrowth in her gut was before treatment. So she's looking a lot better in the gut. Prior to treatment, actually this elastase 1 up there at the top of this image, that is a marker of digestion. So that actually improved. She had better pancreatic function, so she's digesting better. Her secretory IgA was still low, so she's still kind of struggling to get her immune system in the gut lining strong. She did show some gluten antibodies, so that's the immune system attacking gluten. And it also suggested that she had been exposed to it, because you shouldn't have antibodies to gluten if you're not eating any. So even though she was avoiding gluten, apparently it was getting through. And then her follow-up test, she did show some inflammation. So she still was, she wasn't out of the woods yet, let's put it that way. And at 10 months, well, we just looked at her 6 and 7 month testing. So she wasn't feeling great yet. She wasn't out of the woods with her clinical symptoms, but she was kind of heartened by the fact that her test results were looking better. So, she and her clinicians and she were very happy about the progress. Although when it came to her skin, she was still in misery until 10 months. So at 10 months of treatment, her big skin flare-ups stopped. And one thing that was key in this for her was that she realized that when she got gluten, it would trigger her skin flare-ups. So she had to go to extreme lengths to avoid gluten in order to get these flare-ups under control. But she did feel that her skin was starting to heal and she was getting her life back. At 14-month follow-up, she was doing a lot better. She said she could smile again. Her life was so much better. She said she had joy again. The itching and flaking, with topical steroid withdrawal, it's just like a full body flake itching, like the worst itching down to your bones that you can feel. And she would talk about getting out of the bed, and when she would get out of the bed, skin flakes would just be in an outline around her where her body had been lying in the bed. So at 14 months, itching and flaking was gone. Her skin was no longer inflamed or broken, but it was still discolored at the areas that were healing. She felt she could go out in public again. She was empowered. And she really wanted to help other people with topical steroid withdrawal, because there are many people suffering with this who do not know that there are answers. or ways out of it. They just suffer. They're off the steroids, but their skin is just flaring and flaring and flaring, and they don't have any sense of the root causes. At 20-month follow-up, dental follow-up, she's got 1 to 3 millimeter probing depths, no bleeding. Dentist says great periodontal improvement and healthy gums. She was continuing on the dental probiotics, the adrenal support. She was still taking topical progesterone, iron, vitamins. So she was still doing her protocol, even though she had been tested. She was still on her treatments. At 20-month follow-up, Brooke felt like a new woman. She was happy with her health. She was having regular bowel movements and good energy. Her skin was dramatically improved. Although she said, it's not perfectly clear, but she said, I don't aspire for perfection anymore. When her skin would flare up, she didn't run to the doctor and get more steroids, which is what she had done her whole life. So the eczema was gone on her legs and arms, elbows, and back. She no longer used steroids at all and had no steroid withdrawal symptoms at this point. Now, when she would get these flare-ups, she hadn't by this time learned that stress and gluten triggered her eczema breakouts. So with that knowledge, she had the tools to address it. She was less anxious and kind of, conquered by the illness. She could kind of get in the driver's seat and take control and prevent it. Or when it did occur, she knew how to address it and she knew what had happened. So she was very empowered and hopeful about her future. So when I asked her, so what was it? Was it the gut or the mouth that did the trick? And she had this very insightful comment. I don't know if it was my gut or my mouth that helped me get better, but I don't think I would have gotten better had I not treated both. I believe the inflammation in my mouth was affecting my whole body. And I think she's exactly right about that. So I call this case an oral gut skin axis case. I don't believe this axis has been characterized yet. I don't think it's out. I don't know that it's out there in the literature yet, but it should be. I believe Brooke is an example of an oral gut skin axis case. So let's just summarize, because a lot happened with this case, right? Toxins were removed. Gluten and mold was removed. Infections in her mouth and gut were treated. Diets and supplements were used to address inflammation and histamine. Nutrition was replenished. They optimized her digestion and supplied hormones for healing because she was weak in her hormones. So those had to be supplemented so that she could heal. They boosted the microbiome and improved the oral and gut barrier. So we didn't have any tests of the barrier really in this case, but I think just because her skin resolved so beautifully, I really personally believe that her oral barrier and gut barrier improved with all the other improvements we saw. So I just want to give acknowledgements to Dr. Sarah Tevis-Poteet at Dallas Functional Dentistry, and the functional medicine practitioner Ryan Monahan, and Brooke, who so graciously shared her test results, her story, her questions. She really wants to help other people because she has basically her life was saved through 2 years of treatment and this approach. And again, I have this all written up on my blog if you guys would like to read more about the case. So let's pause here and just see about questions. I do have treatments we can go over, kind of things for you guys to think about that you might want to use in your practice. But I wanted to stop and just see, would anyone like to ask any questions about this case or anything else? Because I think it's important for us to have enough time for questions. I guess if you guys did have a question, you need to unmute yourself. Okay.
Question.
Okay, go ahead.
Why are you increasing the HCl?
Yeah, so her original stool test result showed a marker for pancreatic function was weak. It's called elastase 1. And that is a marker that we use to understand about digestion. So her pancreatic function, how well is she digesting? So it's important, of course, to digest well so that you have adequate nutrients and you're getting nutrients from your diet. And it's also important to digest well so that you're killing bad microbes that are coming into the gut. So that's the reasoning, but this is actually a common practice. I'm not sure if you guys, how much exposure you guys have to functional medicine, integrative medicine, but this is a common practice because, and it's a little tricky because we are all taught that too much stomach acid is the problem and that everybody needs a PPI, proton pump inhibitor, if they have reflux, for example. But sometimes the real problem is a lack of stomach acid, and that sets someone up for a lot of problems. So the lack of stomach acid. So as long as and I mean, we could go into it in more detail if you guys were interested, but I mean, there are some contraindications for using stomach acid that, integrative and functional practitioners have to keep in mind. But when you help someone's stomach get more acidic, you're actually just putting it into a healthier, natural balance. I mean, really, the stomach is supposed to be acidic to do its job. And so sometimes you have to use hydrochloric acid. Sometimes it's called betaine HCl is the supplement name. And sometimes people will use diluted, like naturopaths sometimes will use diluted apple cider vinegar as a digestive aid to help improve digestion.
Thank you. So another part of that is, so a lot of these new drugs, the monoclonal antibodies, how would those affect?
Monoclonal.
Like the Skyrizi, the Humira.
How would they affect? Oh, say that again. How would
The
they
biome.
affect the microbiome?
Yes.
Oh gosh, that's a good question. I don't know how they affect the microbiome. We would have to do studies on it, look at the microbiome before and after treatment. The things that worry me the most with the microbiome are antibiotics. Antibiotics, PPIs, actually. I mean, I don't remember to put it in my slides a lot, but being on proton pump inhibitors harms the microbiome because that stomach acid is important for keeping the microbiome in check. So, PPIs, antibiotics, I'm pretty concerned about steroids. I don't know for sure that they affect the microbiome, but I would think they would. I mean, they're very powerful, and I would think that it's, it could shift the microbiome out of balance. I think I've heard more fungal infections with like hormone or steroid use. So I do think those might shift, but some of them, I don't know how the monoclonal antibodies or like the biologics, they're used for like rheumatoid arthritis, et cetera. I don't know that those directly affect the microbiome. I mean, they probably do, but we would need to study it directly.
Okay, thank you.
You're welcome. Anyone else have any questions? Any questions about this case? Why did they do that? Or what was that thing, that they used? Or why didn't they do X, Y, Z? Any questions related to this case? No. Okay. All right, guys.
I was just interested on the nutritional coaching counseling. After she could resume, maybe making her own choices after going into the paleo diet, et cetera. Was she supported that way?
Yeah, she really did with her functional medicine practitioner. She did a very intensive 6-month plan where he met with her once a week. And now he was more like, I would say more like a functional, I can't remember exactly his credentials, but I got, he's basically like a dietitian, functional medicine dietitian with laboratory skills. So he was not a MD or a DO or a naturopath. So what I like about those practitioners is they have the time to hold the patient's hand and help them, really meet with them weekly, check with them on how they're doing. I mean, the diet is so hard. It is so hard to change, your diet, turn it upside down and stick with it. And so, yeah, he now that only lasted 6 months. And then they, I think that was like, it's like a flat fee for that amount of time. And then she was on her own. He put her on the protocol. If they had retested at that point, and then he put her on the protocol to go forward at that point, and she was on her own. But then she kind of, I think, had the habits and she was motivated because things were getting better.
Feeling better,
yeah. And she was, and, she could touch base with him by email or, if she needed it. I don't think she needed him that much at that point.
Okay, nice. One last question.
Sure.
Pro-resolving mediators, that's new for me. Could you just give me a little detail about what they are?
Yeah, they are the substance in fish oil that it resolves the inflammatory cycle. So it's that special. I'm sure there's other things in fish oil that help us. I'm sure, it's not just these pro-resolving mediators, but there's research on it. It's out there with good research about, and it's this unique thing because it's like, in a lot of our inflamed patients, of course, it's this vicious cycle. It's like they can't, what's part of the problem is that they cannot stop the cycle of inflammation, right? In a healthy person, there is an inflammatory response, as there should be, but then there is a resolution where the body says, okay, now I'm going to turn this off and I'm going to go back to homeostasis. I'm going to stop freaking out. So these pro-resolving mediators help conclude that inflammatory cycle and break the cycle essentially, and can be very important for healing. I think there probably are, some patients are just like stuck in a loop. Maybe the original insult is gone, but their body's just stuck in a loop. And maybe you could think about like COVID as an example, where there's this initial infection, but then these long COVID patients, or when the inflammation would get really out of control, it almost had a life of its own. It wasn't about the initial infection anymore. So you will, the one that I have, the supplement that I have that I know about is called SPM Active. But there's others out there, many of the physician line supplement companies are, have these products available. And, you might want to give it with fish oil, because it's not it's not the same as fish oil, but it has a special role in turning off inflammation. And I have heard that there is a study out there about its role in the mouth and turning off oral inflammation, but I have not read that study yet. I just heard about it at the meeting. And I did notice that both this dentist used them in this case, and also Dr. Thompson used it in a case of his. These pro-resolving mediators. So, I'm going to be on the hunt for the literature behind it, but I'm very interested in the background on that.
Great. Okay. Thanks so much.
Sure.
Yes, quick question from Tiffany. What is a good fish oil?
I always recommend high quality physician line brands, and I think you guys have NPI numbers. You guys have clinical practice identification numbers as dietitians. I'm sorry, as dental hygienists, like clinical.
Maybe in the office with the doctor, but for hygienists, we don't.
Oh, hygienists, you don't. Okay. So then you may need to set up these accounts under your dentist's name.
Okay.
If the supplement companies, I mean, I wish they would. You guys should be able to have access to high quality supplements, over the counter supplements.
Mhm.
But you may have to set them up under your dentist. But some of the brands that I like, actually have two different blogs written on this topic, high quality supplements. Because I'm a stickler about the quality. I don't just feel like, any old thing from the grocery store, definitely not anything from Walmart or Sam's Club or Costco. Now, Costco actually is a bit of an exception, but we do need to be really careful about quality. You don't want to take fish oil and then get a bunch of toxic metals in it. So you want supplement companies that are doing third-party testing. And so I would be thinking about some of the most popular physician line companies. So I am allowed to say this, and even though it's a CME,
Yeah.
I mean a CE.
Well.
Yeah, I could I guess I don't know if they can edit it out. It's a problem. But Designs for Health is a physician line company. Metagenics is a prestigious physician line supplement company. Zymogen, that's XYMOGEN. Claire Labs, KLAIRE, they're also called ProThera. Da Vinci Laboratories. And I do not advise people to buy these off of Amazon. I think you need to go to the manufacturer, or you need to know exactly, if the manufacturer is selling it on Amazon, you need to know exactly their, kind of store on Amazon, so that you make sure you're buying it from the manufacturer.
Okay.
Yeah.
All right.
So there's some great supplements that you can, that I believe you can trust. And you can also check my blog on the topic. And I have a, if you sign up for my e-newsletter, we have a free, it's like a free handout on buying high quality supplements, what to look for. And you can, even if you want to download the clinician version, you can put your logo on it and hand it out to your patients, so they can shop for high quality supplements too.
Okay, excellent. Thank you.
Yeah. Okay. Any other questions? So we're a little over already. But I guess that's okay. Maybe I'll just run through these treatments. These are going to be more for your reference. Look at these slides if you're kind of thinking about what you'd like to use. If you'd like to, I don't know if you guys are interested in if you're in a position with your patients to recommend some basic nutritional support or not. So, it depends on your comfort level, and but at least you can know about these, or you can, like we talked about, refer them out for someone else to give them additional support, so that your treatment can be more successful. So I kind of sum up the most important interventions for oral health in my view. Diet. I know some of the dentists think nasal breathing is number one. I just can't let go of diet. I just feel like diet is number one. I can't, we eat it all day long, every day. I just wrote a blog about it was so fascinating looking at the oral microbiome from skeletons that were over 10,000 years old compared to those 5,000, and then skeletons to modern day. And it's very clear that when you have massive dietary changes, like have happened to humans over time, the oral microbiome is affected, and it gets it becomes less diverse. It has more pathogens. And so I'm a big promoter of the diet. We cannot ignore the standard American diet, which is very harmful to the microbiome and to our health, so it's systemic and oral health. Okay, nasal breathing, of course, is huge. It helps grow healthy bacteria in the mouth when you aren't mouth breathing all day long and night. Nutrition, I think, is critical, right? Let's get the tissues in the mouth healthy so that they can be strong to fight illness and fight infection. Dental hygiene is critical as a way of, getting in from the outside and trying to manage the microbial burden. Avoiding allergens and toxins. balancing microbes in the mouth, as there are many ways to do that, lowering inflammation, healing the oral mucosa. I'm thinking about the tissue in the mouth and how to make it healthy and happy, and just boosting the immune system, right? Because at the end of the day, the immune system really does need to beat down the microbial overgrowth. So I'm a promoter, especially after that blog I just wrote, I am a big promoter of the hunter-gatherer diet, because that's when our oral microbiomes were healthiest. So, plant-based, fiber, I mean, we probably should say 0 sugar, but sometimes I just feel it's not exactly realistic in today's world, unfortunately. Healthy proteins, complex carbohydrates. I think everyone needs to be on a multivitamin, mineral, and a probiotic. Toxi paste. This is a term coined by Ellie Campbell. To my knowledge, I think she coined that term. So, I mean, traditional toothpaste are antibiotics. Fluoride is an antibiotic. This was news to me. Again, I'm learning about your fields. I didn't know these things, but not only do we have a lot of irritants and inflammatory products and toxic products in our toothpaste, we also have antibiotics in our toothpaste. I guess it makes sense, because the paradigm is that bad bugs are in our mouth and need to be killed all the time. But, I do think when you're trying to get someone's mouth healthy, if they're reacting to the stuff they're putting, the dental hygiene products, that can be a real problem. So I did write a blog on this topic too. I have my opinions about what are best toothpaste ingredients for the oral microbiome in terms of, how do we support a healthy oral microbiome? Now, this might not be your choice for someone who has periodontal disease or, rampant cavities. You may choose something else for them. But in a healthy person with a healthy microbiome, I don't think they need antibiotic toothpaste with chemicals or irritants in it. They need very simple things that just encourage and support the natural oral microbiome, and they need to have a healthy diet and nasal breathe and things like that. So that can be for your reference. Here are some dosages for what you're looking for nutrition for the oral mucosa. And teeth, right? Teeth are made of minerals. So, I mean, I would want, if I was working with teeth, I would want everyone on minerals to, the average person is deficient in magnesium, for example. I mean, we talk about teeth being made of hydroxyapatite, which is carbon and hydrogen and phosphate, but other minerals are in there too: magnesium, copper, zinc, potassium. So, and if they are on PPIs, they are not getting these things. They are at risk of developing osteoporosis. And I would say they are at risk of, tooth structure damage as well, just because they aren't digesting their food and getting minerals out of their food. B vitamins are critical, right? Folate is so interesting. You can have all of your folate markers normal, all of your blood markers are normal, yet you can have gums that are showing folate need. So you guys may know about this already. This was, again, exciting to me to learn that a folate deficiency can show up first in the gums. So be aware if you've got some patients with really big problems, if they tell you they have low iron or low vitamin D, or, they have other nutritional deficiencies. So, I mean, at the minimum, they need a multivitamin, mineral. I think a multivitamin in the morning with B vitamins is great, and a mineral at night to help them sleep and calming. That's great. I think dental probiotics are wonderful. There's Streptococcus salivarius M18, which is really for the mouth, the teeth. There's Streptococcus salivarius K12, which is really for the ear and throat. So, if mom tells you that the child is having a lot of strep throat, ear infections, etc., Streptococcus salivarius K12 is excellent. There are Streptococcus species probiotic. It's called Probiora Pro. You guys have probably heard about it. And, with this increasing interest in this topic. There are new products coming out all the time. There's a probiotic toothpaste, at least one, there's probably more than one, probiotic mouthwash. I had to scrub all the brand names from this PowerPoint, so I couldn't tell you what they were, but Riven is the one with the mouthwash, and Designs for Health has a probiotic toothpaste. But I think dental and oral probiotics, you know, both the ones for the mouth and the ones for the gut, and even Saccharomyces boulardii, that's a friendly yeast, a probiotic yeast. These are good to do before and after dental procedures, especially if antibiotics are being prescribed. So here is a table that kind of tells you how some of the known probiotics improve dental health. This came from my book. So, you know, they decrease Streptococcus mutans, they reduce periodontal pathogens, they improve gingivitis, they may improve breath, so fresh breath. They can reduce candida. Of course, that can be a big player in cavities as well. So they have benefits. Now, my big criticism here is that we need more natural oral microbes to join in this mix, right? Because lactobacillus is not always a healthy bug in the mouth. And I don't really think it's probably, you know, a major healthy player. So, you know, these obviously do good things for the mouth in these studies. But I hope that's why I like Streptococcus salivarius, because that's a true oral microbe. And it's one of the first ones that we have as babies. So that's, you know, I kind of look at that early oral microbiome as a sign of the microbes that are supposed to be there. These are good foods for encouraging the oral microbiome, prebiotic foods. Okay. I'm going to keep moving. You can use this as, you know, to study, or you can share it with your patients. And gargling, you know, I did another blog. I get to, you know, use my blogs as the opportunity to research and understand my own position on these things. But I really feel like, and I did this with the gargling, with a blog about what to gargle with, you know, what was safe to gargle with. Do gargling solutions damage the oral microbiome? Well, of course they can. Swishes and gargles can kill good bacteria. They're meant to kill bad bacteria or viruses, etc. But I really feel that we need to make a distinction between someone that has a healthy mouth and someone that has a dysbiotic mouth. So, you know, someone that has a healthy mouth with a, you know, they don't need a bunch of things that kill. They need to support their healthy microbiome. So things like just water, you know, gargling with water, swishing with salt water or probiotics or xylitol would, to me, make more sense than using any type of mouthwash. So anyway, just making that distinction. And when nothing else is working, so this is where it's nice to think about the whole human and everything else that's going on. And you guys, I believe, are already tuned in to, you know, mercury and amalgams. I'd love to learn more about, you know, how quickly you guys see that as something that needs to come out, or if you kind of wait and see, or how you decide about that. You know, there may be other sources of infection or immunological stress. So maybe the infection is coming from the gut and making the mouth more weakened and unable to protect itself. So maybe that's why you can't get their oral health under control. They could have fungal, parasitic bacteria, etc. They can have food sensitivities or celiac disease. I mean, celiac disease we know manifests in the mouth. You know, there could be other exposures. You know, mold is one possibility that gets a lot of attention in my field. I'm not a mold expert, but I can't really ignore, you know, its potential to do damage in the sinuses and the respiratory tract, and that could affect the the oral health. Fungal infections in the nasal cavity might be something to look into. I mean, if they have sinus issues, I would be very surprised if they didn't have oral issues too. So inhalant allergens or something else to think about. And then just like in this case, you know, they may have hormonal imbalances. I talk a lot about the adrenals because cortisol, yes, it's a stress hormone and everybody's overly stressed. But adrenal health, having good level adrenals are aware, cortisol is a wear and tear hormone. It is a hormone that it's supposed to only be used in small doses when you're like outrunning a lion or a tiger. You're not supposed to be high in cortisol all day long. And when you are, it damages tissue. It breaks things down. And so I'm very interested in the role that this could have in gum recession and damaged teeth and bones and tissue in the mouth. So to wrap up, I would recommend that we heed the oral gut connection, that we just acknowledge it and think about it with patients. Problems in the mouth can influence the gut and vice versa. I think testing and treating the oral and gut microbiomes in conjunction is amazing when possible. I know it's not always possible. It's okay if we test one and then down the road test the other when things aren't improving the way we expect. Natural treatments can shift the oral microbiome and support oral and gut health. So, there's many natural treatments that we've talked about in this presentation that could be used. Aside from the antibiotics and maybe the topical progesterone and a few other things, all of this is basically over-the-counter stuff and lifestyle changes and dietary changes. And then kind of coming off of this meeting at IFM where we were hitting this home and just realizing the potential of collaborations, right? Collaborations between dentists and dental hygienists and integrative and functional medicine practitioners. I think that holds the solutions that we seek for patients to have better systemic health, better oral health. And I think there's so much potential there. And I hope we can all continue to nurture that possibility. So I would be so honored if you guys would find me online, sign up for my new e-newsletter. I just send it out once a month. I talk about oral microbiome topics and some special functional medicine topics. If you're interested in getting a signed copy of the book, I have one there. You can also buy it on Amazon. And your patients might like the book. I do have plenty of clinicians that tell me they give it to their patients because it is written for a consumer audience, but it's very heavily referenced because I'm really a scientist. So I like to believe it's the best of both worlds. Yeah, and I'm also on social media. So I'd love to connect with you guys. Please follow me. Let me know what you're doing. I'm so excited about this topic, and I want us to keep spreading the message far and wide. I'm at Instagram. I'm at Nelson-Dooley. So it's just great to be here, and thanks everyone so much for staying through to the end.
Oh, thank you, Cass. So much great information. I know Tiffany had one question on xylitol, and actually my dentist is not happy about xylitol either. What are your thoughts on what xylitol does to the gut and the gut microbiome?
Oh, well, are they maybe talking about the symptoms that some patients get with too much xylitol? Do you think that's what they're referring to?
That xylitol destroys the gut microbiome, and that we shouldn't be using any xylitol is what my docs are talking about.
Okay. Well, I'd like to see more about that. That isn't the word on the street to my knowledge so far. Of course, xylitol is great for suppressing pathogens in the mouth like strep mutans. Well, I hesitate to call it a pathogen, but it's potentially bad bacteria. It also makes it hard for candida to attach in the mouth. Now, I do know that some people can have like some bloating from excess xylitol, so I would wonder about that. But I haven't read anything that it acts as an antibiotic to the gut microbiome.
That it kills the good bacteria is the concern.
Is what they're saying. Yeah, I guess I just need to see that study. So if your dentist has that information, I'd like to see that. That's news to me. We still talk about xylitol in functional medicine. So, I mean, it can act as a prebiotic, can actually feed good bacteria too. So
Okay.
it may have some different sides to it, it wouldn't surprise me if there, there's some different layers to xylitol, and we may just need to, get all the information and then make that decision. But yeah, I'd love to see that information.
Okay, very good. Thank you. All right,
Sure.
anybody else have any questions for Cass? All right,
Let me ask a question real quickly,
Sure.
if you don't mind. I know we've pushed it to an hour and a half. What about you guys? Tell me about your, I know you aren't all doing the same thing, but I'm curious, what are you guys looking at when, are amalgams a big focus for you guys? Is just, I know that Barbara has showed me the tests she uses and the types of treatments she uses, but I'm curious kind of what are your go-to things? What distinguishes you guys from the dental hygienists, on the corner? What types of things are you guys thinking of first when you're trying to optimize someone's oral health?
The big thing that we're doing is really looking at the airway. So like you mentioned a little bit about cortisol. So we're having our patients do a CBCT and a sleep test, measuring their oxygen and their heart rate, how many times they get disturbances throughout the night. And then from there, linking that to the cortisol.
Ah, neat. Thank you.
And that's also affecting their teeth and gums, because a lot of times they're grinding their teeth, bringing that bottom jaw forward to open up the airway to get more oxygen.
Right. Great, thank you. Are you guys able to advise around diet with your patients, or I don't know if you guys ever make nutritional recommendations otherwise, or where do amalgams come into your conversation with your patients, or is that more something the dentist discusses?
I don't know that looking at the amalgams is first and foremost in my, information that I share, but definitely the leaky gums is probably what I try to help clients understand. How it really affects total health. So I'm kind of trying to connect the dots for clients, and so balancing is a big focus for me. And of course, like you said, there is a time and place for antibiotics and for antimicrobials to be used, but I really like the toxic paste, or whatever that term doctor coined. I think most of the other over-the-counter dental oral health care products are really toxic for us, and so it's just such a complex topic when you look into someone's mouth. And I've been a hygienist for a very long time, and I still don't see that we're making a big dent in periodontal disease. The level of what I see is concerning, really alarming.
Wow.
And we are talking a lot about amalgams and how 50% of that is mercury, and it's binding to the receptors in the brain and the gut. And a lot of our patients will get them removed and then do a blood test before and after to show the mercury levels, how they've changed.
Great, okay.
Let's see. All right. Well, Cass, thank you so very, very much. This was
Thank you, guys.
amazing. I'm going to have to go back through it after it's recorded today, and then it will be available again for people to listen to. So I'm honored that you spent time with us and shared all your pearls. Such
Absolutely.
good stuff.
Thank you. My pleasure. It's an honor to be
Yeah.
with you guys too. And thanks for everything you're doing to help your patients.
Well, and thank you. You're the other half of this. You know,
Right.
we can't heal the mouth without healing the gut. So having more gut information is critical. So,
Wonderful.
so excellent. And thank you everybody for coming today. I will make sure Kim gives us all an hour and a half of CE credit. And I have all your names down except for iPad 2. I don't know who you are. So you can message me and let me know. And then we are not going to meet next month because it's July and it's summer. So, so I'm still looking for a speaker for August, and then we will meet all in Orlando in September, and then we'll resume again with our Zoom meetings on Saturday in October. So, so thank you everyone for coming, and have a glorious weekend. And any questions, let me know. Oh, Heather, okay, got you down. Excellent. All right, I will give Kim all your names and then she'll email you CE credits. So thank you, everybody. Have a great weekend. And I will see you again in August, and then I'll see you all in September in Orlando. So save the date, because we're meeting with AOSH and AAPMD, which is an airway group. So it's going to be an awesome meeting. It will just blow your mind. There's so much good information. So come join me in September in Orlando. All right, everybody.
Great.
Have a good weekend.
Great. You
Thanks.
too. Thanks.
Thanks,
Thank
everyone.
you.
Bye-bye.
Excellent, Cass.
Oh,
So
thank you. My
good.
pleasure.
Yeah, there's, just, how do we heal the oral microbiome? We got to heal the gut.
Yeah, it's all
makes sense.
connected. It is. It's really, it's neat, and I'm excited about this collaboration and talking with you guys. It's a new group for me to talk to. I don't usually talk to dental professionals,
Well, this is the beginning of the gut here. So
Right.
how can we not not address it?
Right, exactly.
Yeah. And I actually have a patient I want to chat with you about. She's not actually a patient. She's just somebody who's reached out to me online, who
Mhm.
her salivary glands have atrophied through her oral, through systemic issues. And she's got no saliva.
I think she may have reached out to me too.
Oh, okay. All
Is
right.
the last name Blum, BLUM?
Yes.
Yep, she's reached out to me too. Yeah.
Okay.
I know. It sounds very grave.
Yeah. So, okay. Well, then have you referred her over to Ryan?
Well, she sent me a bunch of stuff she wanted me to look at, and I was kind of like, okay, hold on, are you wanting to hire me as a consultant, or, do you have a functional medicine practitioner and a functional dentist? I mean, I think she needs like a very good team,
Yeah.
So I haven't quite followed up in that conversation because I was at IFM, but, so, I feel I could offer her some tips, but I also think she needs someone like really,
Mhm.
feet on the ground, looking closely at what's going on with her, following up with her, trying to do some trial and error to see what can help her. Because
Okay.
if the saliva isn't flowing, you're kind of screwed.
Yeah. Well, that is true.
Yeah. So then you just got to figure out, okay, how do you make the best of a bad situation is how I kind of look at it. What's your thought about the fact that her salivary glands aren't working?
Well, I don't know where to go. I've given her the artificial stuff that she can swish with just to relieve her discomfort. But
Right.
I haven't got, I don't know how to revitalize them,
Right.
if they're salvageable or not. So,
Right. Right. I mean, there may be a chance that, you know, the damage could be healed.
Yeah.
But that would need a different, you know, someone to closely watch her and do it from an integrative functional perspective, I think.
Okay.
So yeah, but I'm glad to know you're in contact with her too, and you're trying to help her. And
Yeah.
she's out there getting some help. That's for her, trying to get some
Oh.
help. Poor baby.
Well,
Poor
yeah.
thing.
So
Yeah. So okay. Well, we can, you know, email about that too
okay.
if you want. But yeah, I mean, I'm happy that I told her I'm happy to look at all her labs and give her some, you know, I would need to dive into her case to really understand, but I would like her to have a great team.
Yeah.
Not
good.
easier
Well, I'm
said than
glad
done.
that she's reached out to you then. Good.
Yeah.
Good.
Okay. All right.
All
Barbara.
right. Well, good.
Thanks
It was
again.
thank you. It was great to see you.
Good
And
to
I
see you
will see
too.
you again at some point, I'm sure.
Yes, absolutely. Let's do more together, and send me
Okay.
that article about xylitol damaging the gut microbiome.
Yeah, I you know, I'll dig and see where they're coming from, but
Yeah.
you know, what Tiffany said, you know, I've heard from my docs too, and I've got a functional medicine
okay.
doc who also
Okay.
doesn't like it. So it's like,
Oh boy.
I mean,
No, I have
everything in
heard.
dentistry has xylitol. I
I
mean,
know.
everything.
Well, gosh, and it has so many benefits too that
I know.
that are established. But you know what? I'm starting to think I feel like I remember one of my clients telling me that they were very careful about where they were sourcing their xylitol from.
Yeah, I've heard
Um,
that too, that from corn is not, you know,
as
because of the
good.
GMOs in the corn. So
Yeah. Okay.
that
Well,
birch
good.
is better. Who knows?
That would make sense. I mean, you
Yeah.
know, from the source would be nice. Okay. Yeah. Well, I'll look forward to learning more about that. I wouldn't be
Okay.
surprised if, you know, I mean, if your functional doc is telling you no, then there's probably something to it.
So, okay,
So,
well, I'll reach out to her and see if she can give me the study and I'll send that on to you.
thank
So,
you.
gosh,
All
I'd
right,
hate to
Barbara.
lose xylitol.
I know. I mean, that's one that I think is really cool. Gosh,
Yeah.
and the literature's seen. I mean, even Ellie Campbell was talking about, you know, mom chews xylitol gum when pregnant, baby doesn't get cavities for 5 years. I mean, that's old research, but that's,
Yeah.
I mean, that's pretty
Yeah.
powerful.
No,
So.
I rely on xylitol. So, but you know, where do we go? So everything has a positive and a negative. So.
Right, catch-22. We're always caught in them.
All right.
Have a
Enjoy your weekend. Thank you so much for
too.
your time.
My
And I will see you
pleasure.
soon.
Great to see you.
Alrighty.
All right, Barbara.
Okay. Thank
Bye
you.
now.
Bye-bye.